Is your mouth always dry? If yes, your body is trying to warn you about a hidden problem, a problem that can destroy even the healthiest teeth in less than a year. Hi everybody, I'm Dr. Mehnaz, a dentist, and today we're going to break down all the real causes of dry mouth. So, if your mouth keeps getting dry and you constantly need to drink water, stay with me so we can figure out the reason. The first major cause is medications. You should check the medicines you're taking because 90% of my patients who complain about dry mouth don't even know their medication is directly reducing saliva. Anti-anxiety meds, antidepressant, allergy meds like antihistamines, and blood pressure medication can reduce saliva and cause dryness. The good news, in many cases, adjusting the dose or timing of the medication can improve the condition by up to 50%. The second big cause that most people ignore is stress. Stress is the silent killer of saliva. When you're stressed, your body goes into fight or flight mode, meaning that your brain thinks you need to fight or run. So, in that state, your body doesn't care about digestion, saliva, or keeping your mouth moist. The result? Less saliva, faster evaporation, and sudden dryness in the middle of the day. That's why some people say my mouth suddenly gets dry at random times. So remember, nothing is worth risking your health. Slow down, stay calm, and take a deep breath. The third cause is snoring and sleeping with your mouth open. When you sleep with your mouth open, saliva evaporates. You wake up with bad breath, dry mouth, and sticky tongue. Saliva protects your teeth at night, and when it dries out, your teeth are completely unprotected. Typical signs include morning bad breath, a sticky tongue, dry throat, cracked corner of the lips, and that awful dry feeling when you wake up. If none of these apply to you, then high caffeine and alcohol intake might be the reason. People think only coffee causes dry mouth, but alcoholic drinks and Coke Zero also dry out your mouth. Caffeine temporarily constricts the blood vessels of your salivary glands and reduces saliva production. The result, even 1 cup of black coffee can dry your mouth. So reduce these drinks and always drink water afterward. Another important point, some medical conditions directly reduce saliva, especially uncontrolled diabetes. When your blood sugar is high, your body pulls water from tissues to remove extra sugar. This leads to dehydration and reduced saliva. That's why people with high blood sugar feel thirsty all the time, drink constantly, and still feel dry. Another condition is thyroid disorders, especially hypothyroidism. When the thyroid is underactive, the body goes into slow mode. Your metabolism slows down, saliva flow decreases, and your salivary gland becomes sluggish. Dry mouth is one of the common symptoms of hypothyroidism. If dry mouth comes with fatigue, feeling cold easily, or swollen tongue, you should consider a simple TSH and T4 test. Another hidden factor is hormonal fluctuations, especially in women. Periods, pregnancy, breastfeeding, or some hormonal pills can affect the salivary glands. This is totally normal and usually improves when hormone levels stabilize. And of course, you should know that smoking and vaping are the major causes of dry mouth and damage to the teeth and gums. If none of the previous reasons apply to you, you might be using alcohol-based mouthwashes. Alcohol strips away the natural moisture in your mouth. It feels cool at first, but a few hours later, your mouth becomes even drier. Your breath worsens, your gums get irritated, and saliva drops. Alcohol mouthwash is only good for specific short-term causes like wounds or infection. For daily use, always choose alcohol-free mouthwash. Another factor people don't talk about enough is poor quality sleep or lack of sleep. When sleep decreases, the body releases stress hormones, and the same cycle that reduces saliva starts again. And the last reason for dry mouth is deficiencies in vitamins like B12 and iron, which can affect saliva production. This is especially common in people who follow strict diets or are strict vegans. Your body needs these nutrients to repair oral tissues and keep salivary glands functioning properly. When they are low, dryness appears. Now that we've covered all the causes, here's something most people do not know. Dry mouth affects your sense of taste. Saliva is a natural solvent for food particles, and without it, your taste buds can't work properly. Many people who say everything I eat tastes bland actually have dry mouth, not a tongue problem. Dry mouth also causes morning bad breath even if your teeth are perfectly healthy. So what can you do about it? Drink enough water, avoid alcohol-based mouthwash, treat snoring, discuss your medication with your doctor, reduce alcohol and caffeine, cut down smoking and vaping, lower stress, and visit your dentist every 3 to 6 months. Finally, dry mouth isn't a small symptom, it's a serious message from your body. It's your body whispering that something isn't right. If it persists, do not ignore it. Your body always sends signals quietly before it starts shouting. Just listen, because your mouth is a mirror of your body.